9% of women have PCOS, and my idea about that is I say, wow, if that actually reduces your fertility, how come it's so common? How come nearly 1 in 10 women have got it? And I think that it probably in evolution hasn't affected fertility, and that it's obviously given some selective advantage. It's probably given some advantage that we don't yet know. But we don't really know if it affects fertility, but I suspect it probably doesn't. Nobody's actually taken a group of young women with PCOS and then followed them over a 20-year period and seen if they had their babies when they wanted to have them. And that study may never be done. What we do know is that if a woman has PCOS, if she becomes obese, the manifestations become a lot worse. And also we know that if she needs fertility treatment because she perhaps gets a sexually transmitted infection and her tubes are blocked, or if she chooses a partner who happens to have a low sperm count and she needs IVF, we know that she is particularly sensitive to the drugs used in IVF, and one needs to be very careful about that. But I would actually, as I say to my young girls when they're diagnosed with PCOS, I say I can't tell you that you're definitely going to be able to have a baby, because nobody really knows that until the baby's actually plonked in their arms. But I think as a group you're probably right, but it's important to take in measures to protect your fertility. And for women with PCOS, it will be avoiding weight gain, not smoking cigarettes, reducing the number of sexual partners so that you don't collect sexually transmitted infections which might compromise your fertility, those sort of things.
Right. So good general advice, really, isn't it?
It is. I think it probably applies to all women in that way, yes.